Thank you. Good morning. It's really a pleasure and honor for me to be here. I was asked to speak on the improving maternal and fetal survivals through ultrasound education locally and globally. So I will start initially with the global aspect of this, and then I'll wrap up talking about locally, especially with regards to residency programs. So maternal mortality, as you know, is defined as any death occurring any time during pregnancy and up to 42 days postpartum. It's a major problem, as you know. It's estimated at 529,000 per year in the world, and 99% of maternal mortality occur in the developing world. The problem is so acute. We've done quite well, actually, in the last 5 to 7 years on this, but it's a major, major problem in the developing country. Just to give you an idea, by the time I'll be finished with this presentation, 15 women would have died somewhere in the world from complications associated with childbirth or pregnancy. The rates of maternal mortality vary tremendously between countries. It's as low as 3 per 100,000 in Sweden, and as high as 1,600 to 1,800 per 100,000 in Afghanistan. There's also tremendous variations with regards to the lifetime risk of dying from maternal mortality. So if you happen to live in Ireland, your chance of dying from complications related to pregnancy is about 1 in 47,000. If you live in Sierra Leone, that risk is about 1 in 8. So there's certainly giving birth safely is a privilege of the rich. So what are some of the primary causes of mortality in the developing world? As you know, hemorrhage tops the list, followed by infection, eclampsia. Eclampsia is quite common in the Caribbean countries. It's second or third overall in the world. Complications related to unsafe abortions also contribute about 13%. The issue with hemorrhage is so significant, especially as it relates to maternal morbidity and mortality, and I'm going to show you the impact of this, especially in the developing world. So in untreated obstetric conditions, a ruptured uterus takes about 24 hours for maternal mortality without any treatment. Antepartum hemorrhage, about 12 hours, and postpartum hemorrhage, about 2 hours, primarily due to hypovolemia and hemorrhagic shock. The issue with this, even in the developed countries, that a significant proportion of these mortalities are preventable if timely intervention is provided and if the diagnosis is made early and resources are available to treat. Just to show you the limitations in many of the developing countries, you see on this slide, this is in Haiti, this is a patient we encountered that being transported following an eclamptic seizure for about 2 hours walk to get to the closest hospital. And you could see the roads surrounding this area, how they become rivers, especially in the raining season. So we're talking about maternal mortality. A bigger impact, it's certainly maternal morbidity with regards to the numbers. About 300 million women in the developing world currently suffer from short or long-term illnesses related to pregnancy. And at the top of the list is obstetric fistulas that occur from primarily obstructed labor. About 100,000 new cases occur each year in Africa alone. Many of those cause significant problems with regards to the outcome and with regards to the psychological impact it leaves on women. About 90% of fistula patients have contemplated suicide at one time or another. So how is ultrasound related to this, and how could we make a difference or impact by ultrasound? So antenatal care is actually quite utilized as maternal services in many of the developing countries. For instance, in Port-au-Prince in Haiti, about 60 to 70% of women seek prenatal care. Only about 30 to 40% deliver at hospitals. So antenatal care should be used as a platform to promote health and ensure safe delivery. And this is where we feel ultrasound services may play a critical role in this regard, because most of the patients are actually available to you in many of the developing countries. So how can ultrasound impact maternal mortality? Certainly, it has a big role in hemorrhage by diagnosing placental abnormalities prenatally and ensuring delivery at a hospital with facilities able to provide support. It can assist postpartum on labor and delivery by retained placenta and localizing the placenta, and certainly in ectopic pregnancies, making the diagnosis early and impacting outcome that way. With regards to labor, ultrasound plays a critical role in making diagnosis of multiple pregnancy ahead of time and ensuring delivery in a center able to handle that, assisting with abnormal fetal presentation at the time of labor, estimated fetal weight, and certainly with obstructed labor. On the aspect of perinatal asphyxia, accurate pregnancy dating plays a critical role in reducing post-date pregnancies, diagnosing growth restriction, also assessing fetal well-being and amniotic fluid. So ultrasound will have an impact if you identify at-risk pregnancies and direct those at-risk pregnancies to deliver in a hospital setting where resources are available, and also the use of ultrasound in managing obstetrical complications. So the conceptual framework of this approach is something like this, where due to the poor socioeconomic environments, there's lack of skilled physicians and midwives in ultrasound and unavailability of ultrasound technology, which would lead to undiagnosed multiple pregnancies, undiagnosed placental abnormalities, and ruptured ectopic pregnancies that can lead to significant morbidities and mortalities and poor pregnancy outcome. So what has been done? A lot of work has been done globally by many societies and investigators on this topic. I'm going to share with you briefly what we have done as part of the International Society of Ultrasound in OBGYN outreach program. The program is designed with the mission of introducing ultrasound in the developing world and training physicians and midwives in the use of ultrasound with the goal of reducing maternal morbidity and mortality. This is the initial program in Haiti. This is where the program was launched in collaboration with Partners in Health. There's 3 trips that have been done to Haiti. GE was a partner, GE Healthcare was a partner in this program and donated 10 ultrasound equipment to the various clinics of Partners in Health in the Central Plateau. And Partners in Health were the local support for the training sessions itself. Several trips were done to Haiti in collaboration with Médecins Sans Frontières and the Rava Foundation. It's an Italian foundation, and Operation Blessing International at St. Damian's Hospital, which is a children's hospital that actually expanded following the earthquake to provide high-risk women's services. You have 3 trips to Ghana in support with Siemens that donated 3 ultrasound machines. Physicians for Peace is an international organization that we partnered with, and this was part of the Millennium Cities Initiative that provided the local support and hosted the team. There are 2 trips that were sent to Somaliland in collaboration with Doctors Without Borders at Edna Adan Hospital, and this is Sonosite donated 4 ultrasound equipment for this training session. And recently, the team just came back actually from Mongolia. This was the 2nd trip where Samsung Medison donated 4 ultrasound equipment, and this was done in association with the South Korean Ultrasound Society and with the support from the central government in Mongolia. The course structure is as follows. There's a basic physics of ultrasound, the functionality of the equipment that is donated, and then the bulk of the course is a hands-on approach to topics that are relevant to basic obstetrical ultrasound, such as fetal presentation, placenta localization, amniotic fluid assessment, and pregnancy dating. And then these topics are expanded to discuss ectopic pregnancy, placenta previa, adnexal masses, and so forth. Tracking the impacts at the level of the educational aspect is pre and post training surveys on the number of trainees who scored 80% or more on the post-training tests, and the number of trainees who demonstrated competency by the trainers on their competency checklist, with about 80% of the required planes successfully obtained. On the clinical impact of the program, tracking the impact clinically, we look at the number of pregnant women with 4 or more prenatal care visits during pregnancy in those clinics where ultrasound is being introduced. number of pregnant women with at least one ultrasound exam performed in pregnancy, the number of pregnant women with change in pregnancy dating due to ultrasound, and then we track at least one of the following high-risk clinical diagnoses performed by ultrasound: multiple pregnancy, placenta previa, abnormal fetal presentation, and ectopic pregnancy. This is some information from Kumasi in Ghana, just to show you the impact of introducing ultrasound there. This is following their third training trip, where 2 or 3 of the trainees become trainers themselves and become the leaders of ultrasound in that community. And you could see here the number of scans that have been performed, and you could see that 3 categorized as life-threatening, such as ectopic pregnancy, extrauterine pregnancy, and placenta previa that were diagnosed, 13 high-risk diagnoses for twins, polyhydramnios, and breech, with 7 immediate intervention and 12 referrals for delivery in the hospital. This is for 1 month, month of July 2012. So what we have done through the program is there are 24 trainers that have been at these missions, as you could see, throughout the developing world. 17 systems have been donated in 4 locations, a total of 112 trainees. And the cost of the program had been maintained fairly low. It's calculated at about 1,026 pounds, British pounds, per year per trainee. And the reason why the costs are maintained so low is because the skills, the time, and the travel costs are donated by the volunteers. We have generous donations from industry, as you can see, our industry partners, and tremendous local and logistical support on the ground from the non-government organizations that we work with. So what is the evidence that ultrasound actually impacts pregnancy care or impacts care in the developing world? As you know, there's not a lot of evidence on this. There's an ongoing trial that is now happening in Pakistan and India to really assess the impact of introducing ultrasound on women's health in the developing world. But we have some data that's actually quite reassuring. So this study by Dr. Shah, Sashita did this study in Rwanda. You see Vicky is one of the authors on this, to see that what is the impact of introducing ultrasound. This is with Partners in Health in Rwanda. And you see, first of all, this table shows the demographics of the patients receiving ultrasounds. And at least on the analysis of data from this study, it shows that ultrasound has been used primarily in 2 main areas, as in the abdomen and in obstetrics. And the impact of introducing ultrasound is a change in management about 43% of patients. And most of the change comes from doing a surgical procedure. A cesarean section contributes to a significant number of those, and the medication change in relations to the ultrasound. Other studies have shown also that introducing ultrasound, even in an inpatient setting, makes a difference. This study showed a change in patient management is in about 53% of patients scanned. And there's several abstracts here that show the impact of introducing ultrasound in the developing world. Shifting now to the local scene, and I'm going to focus a little bit on the residency programs and training in the residency programs in OBGYN and in emergency medicine. This is the ACGME program requirements for graduate medical education in obstetrics and gynecology, and this was the most updated one from 2008. And for obstetrics and gynecology, there's a section on ultrasound that states that the full range of commonly employed obstetrical diagnostic procedures, including ultrasonography and other relevant imaging techniques. These are milestones that need to be met as part of the training program for residents in the United States. Then they published, the Residency Review Committee for Obstetrics and Gynecology published the minimum thresholds. This is recent, this is in 2012, that residents need to meet as part of their training in obstetrics and gynecology. And I highlighted in obstetrical ultrasound 50 documented cases per 4 years, and in transvaginal ultrasound 50 documented cases per 4 years. So that's not a lot of cases, but this is the minimum that is required. And this slide here shows you the 2012 data with regards to where the mean is for all the programs, the approved programs in the United States, and what's the quantiles for various performance. And you could see that the mean is somewhere around 103 cases per 4 years. So the requirement at least has been more strengthened recently, and these are new, and there's a new push to really enhance the training and education of ultrasound in OBGYN residency. The same happens for emergency medicine. This is from their ACGME program requirements in 2013, and it states that residents must use ultrasound for the bedside diagnostic evaluation of emergency medical conditions and diagnosis, resuscitation of the acutely ill or injured patients, and procedural guidance. And the ACGME mandates procedural competency for all emergency medicine residents. It's considered a skill that's integral to the practice of emergency medicine. So there's a strong push at the level of the RRC to really mandate residency training in ultrasound and track that performance. And the American College of Emergency Physicians actually have a very extensive document on training of ultrasound that actually highlights how the training should be done and how the competency should be met in various core procedures. What I think is needed further, but if you look at the ACGME requirements for other residency programs, such as internal medicine, family medicine, or the surgical specialties, you rarely find any reference to ultrasound. So there needs to be a push to expand the requirement for training of ultrasound. And if you look at the local level, if you look within the various residency programs, you see that what's needed really is a lack of a comprehensive and uniform curriculum. There is not a good curriculum that residents across the country can use in training in ultrasound. And I've had several discussions now with the American Board of OBGYN and the American Congress of Obstetrics and Gynecology about devising actually a program for residency training that could be used as a model for all residents across the country by program directors. Because if you happen to have a program director that is well in tuned in ultrasound, then the ultrasound training is usually well structured. But for the majority of residency programs, the ultrasound training is not very well structured. There's also lack of competency evaluation. So as ultrasound is a hands-on imaging modality, there's really lack of a competency evaluation across residency programs to really assess whether the residents have met the competency in actually obtaining the images required for comprehensive exams. There's certainly need for more faculty trainers in various residency programs, and that has a tremendous impact on the successful introduction of ultrasound in residency training. And in many residency trainings, at least in OBGYN, there's really a lack of faculty that are well-versed in ultrasound training. There need to be expansion of simulation in training for ultrasound, and certainly a larger focus on lifelong learning in ultrasound. I would like to thank you for your attention, and I'll be happy to answer any questions. Thank you.